Welcome, future nurses, to Implementing and Evaluating Chapter 14 of Kozier and Erb's Fundamentals of Nursing. Please like and subscribe if you find this information helpful, and just comment below any suggestions or questions that you may have. Let's get started. So the chapter begins with implementing. Implementing is performing and documenting nursing interventions. So your interventions is what you do as the nurse. So it can be giving an injection, administering medications, performing an assessment, elevating the patient's leg. It's whatever you decide to do as the nurse. And all the previous steps in the nursing process contribute to implementing. And just keep in mind that you always want to constantly assess your patient, especially during implementing, just to notice any subtle changes or anything like that, and to also see if you still need to perform the intervention as planned. Implementing requires different skills. The first type is cognitive skills, which are problem solving, decision making, critical thinking, clinical reasoning, and creativity, and it's all used to provide safe nursing care. Next are interpersonal skills, which involves nonverbal and verbal communication, and it is necessary for caring, comforting, advocating, referring, counseling, and supporting your patient. And you not only use this with your patient, but also with other members of the healthcare team. So it's important to have good interpersonal skills so that you can provide the most effective care for your patient. And lastly are technical skills, which are just your hands-on skills. So like the process of administering an injection, or if you inserted a Foley catheter or inserted a nasal gastric tube, is actual hands-on skills. The process of implementing begins with reassessing your patient. Before you perform any intervention, you always want to reassess your patient because the patient may not need the intervention anymore. A good example of this is if you were there to administer a beta blocker, you need to reassess your patient's blood pressure because their blood pressure may have dropped since you last seen them. And if you administer the beta blocker, their blood pressure can drop even lower and you can send them into shock or kill them. So it's really important that you always reassess your patient before you perform any intervention. And you may be tested on this because I was. Next, you want to determine the need for assistance, and you want to implement the nursing intervention. Make sure you provide privacy, ensure your patient's safety, and individualize the intervention to your patient, and always encourage the patient to participate. Next, you want to supervise delegated care. You can delegate care to a CNA, LPN, medical assistant, patient care tech, and you don't have to physically be there when they perform the care, but you always need to make sure that the care was provided correctly and that it was ultimately provided, period. Because if anything goes wrong with your patient, it will be your fault as the nurse. And lastly, you want to document the nursing activities. Evaluating is the last step in the nursing process, and evaluating is a planned, ongoing, purposeful activity in which clients and health professionals determine the client's progress towards completing goals and the effectiveness of the nursing care plan. And this can be done during or after an intervention. And just keep in mind that you always want to reassess and evaluate all the time, just to make sure that your patient is being provided the most effective care. The process of evaluating includes collecting data related to desired outcomes, comparing data with desired outcomes, relating nursing activities to outcomes, drawing conclusions about a problem status, and continuing, modifying, or terminating the nursing care plan. Evaluating the quality of nursing care involves the quality assurance program. This has 3 different components. The first is a structural evaluation, which answers the question, what effect does the setting have on the quality of care? So it evaluates the hospital setting or whatever setting that care is being provided in to see if it has some effect on the actual quality of care that the patient is receiving. Next is the process evaluation, which is how the care was given, and it answers the question, is the care appropriate, timely, and complete? And lastly is an outcome evaluation, which evaluates the change in the patient's health status related to the care. So this actually follows how effective the care was. Like, did the patient's health improve? Like, was the actual care effective for the patient as far as their health status goes? And just remember that the quality assurance program focuses on ensuring care was effective for the patient. So all three of those different components is all about focusing on ensuring the care was effective for the patient. Another source of evaluating is quality improvement. There has been a growing focus on increasing the knowledge of medical errors and creating systems to enhance safe care. The Joint Commission issues Sentinel Event Alerts, and Sentinel events are unexpected incidents involving death or serious physical or psychological injury. And the Joint Commission sends out alerts about these events to all the different healthcare facilities to ensure that these events don't happen again. And quality improvement is a part of the 6 competencies of QSIN, and it just focuses on the processes and the systems involved with care and improving care. So quality improvement focuses on the processes and the systems, and then quality assurance program focuses on ensuring that effective care was given. Evaluating the quality of nursing care also includes nursing sensitive indicators. The National Quality Forum is a non-profit organization that focuses on improving healthcare, and they created standards for nursing sensitive care. And the Joint Commission released 12 nursing sensitive care measures in 2009 after reviewing the National Quality Forum standards. And it's just used to evaluate the quality of nursing care. And the National Quality Forum also includes SREs, which stands for Serious Reportable Events, and they're also called never events. And these are just situations that should never happen involving equipment being used or procedures being done. And these events, if they do happen, they're not reimbursed by insurances because they should never happen. Next is the nursing audit, which is another way of evaluating the quality of nursing care. The nursing audit is just reviewing records, and there are 2 different types. You have the retrospective audit, which reviews patients' records after they are discharged, and then you have the concurrent audit, which is evaluating the patient's care while they are still in the facility. You also have the peer review, which is just other nurses reviewing the quality of care performed by other nurses, and they use established guidelines when doing this. And the nursing audit reviews records to evaluate care and focuses on documentation. So with nursing audits, documentation is super important, and documentation is super important, period, because it helps to protect nurses and also protect patients as far as like legal actions goes and as far as whether care was performed. So super important to document. I just want to thank you so much for watching, and I just want to wish all the future nurses out there good luck. Please like and subscribe if you found this information helpful, and please comment below any questions you may have or any suggestions for improvement, and just thank you so much for watching.